Corporate versus private practice. Which should you choose? This topic has been addressed so many times, but people still have the same questions. Hey guys, my name is Dr. Amanpreet Singh, and welcome back to Dental Secrets. I wanted to talk about a common topic for dentists looking for new jobs, especially for new grads who are just eager to get started and don't know too much about the real world of dentistry yet. So I've worked at both corporate and private practice, and I can kind of shed some light as to what I liked versus what I didn't like about each, and help you guys just understand the differences of both so that you can come to a more informed decision when you're choosing where to work at. So if you're right out of school and looking for a new job, you're probably in one of two categories. Either you want to start working right away and get out and just start practicing your skills. You know, you're eager, you're hungry, and you just want to start doing dentistry, right? I mean, that's what you've been training all these years for. Or you just want to break from dentistry altogether. I mean, once you start, that's it. You are working every single day for the rest of your life until you die. Now's the time to take your vacations, travel, and relax before you make that big commitment. Now, both approaches are fine. I mean, I definitely wanted to take a little break before I started, but no matter what you're doing, you want to take your time choosing the right place to work. When you start applying, especially if you're a new grad, most people are going to overlook you. That's just the way it is. But you're also going to get some people that reach out to you and seem kind of desperate. Now, this is where you'll start seeing some offers with real money. And believe me, if you're right out of school and you are just getting into the workforce, it's really hard to turn these offers down because you're so used to money coming out of your own pocket and doing dentistry for free that seeing real money is really hard to say no to. But I cannot stress this enough. You have to read over the contract, especially corporate places and sometimes private practices, but they tend to have very long contracts. And most of the contracts have very extreme wording. I highly recommend you get a lawyer to look it over before you sign anything. Now, I know you're thinking, like, dude, I just graduated, I haven't even made any money, I have to pay off my loans, and now you expect me to pay some lawyer before I even start making money? But when people say that, I say just think about the amount of time you're committing. If you sign a contract and you start working at a place and you absolutely hate it and you want to quit right away, chances are you're going to be working there at least 6 months no matter what, even if you hate it. So we're talking about at least 6 months of your life, if not more. I think that's worth spending at least a couple $100 on a lawyer to make sure you're not getting screwed. And you don't have to do this with every single offer you get. You can read over the ones on your own and kind of sort out which ones you like versus which ones you don't like. And if you're thinking about signing, I would show it to a lawyer. So let's talk about each. Let's talk about corporate and private practice and the pros and cons of each. So starting with corporate, the first pro I have is you can make a lot of money initially. Now, the key word here is initially. Corporate offices tend to have higher sign-on bonuses. They tend to have a higher daily minimum, but that's really it. You know, you get a certain percentage of production, but you're really capped there. And the reason is you're seeing a lot of patients that have lower quality insurances. So you're seeing a lot of Medicaid patients. And while that's good because these patients do need a lot of help and they do need care, it's really hard for you to expand on your skills. And this is what I mean by you being capped, because you're going to be great at doing fillings, extractions, all the bread and butter dentistry. But if you ever wanted to expand your skills and do some veneers, other cosmetic cases, or implants, you're really not going to have the patient base to do that on. And it's really tough when you take a CE course and you spend all this money, but you can't implement it into your practice. So that's something to consider if you're thinking about working in corporate. Are you okay with just doing the bread and butter dentistry and occasionally doing something a little more complex? Or do you want a place where you can venture out, take some CE courses, and try new skills? If that sounds more like you, corporate might not be the best fit. Now, if you just graduated dental school, corporate doesn't sound so bad because you're mainly going to be doing the bread and butter dentistry anyway. And on top of that, you're making good money and you get to practice a lot of dentistry and you can start paying off your loans right away. So going off of that, another pro to corporate is you get some good experience. And again, take this with a grain of salt. It's good experience at certain procedures. You're not going to get good experience at implants or veneers, you're going to get good experience at crowns, fillings, dentures, extractions, sometimes root canals depending on the insurances, but all the bread and butter dentistry you're going to get pretty good at. And the other thing with corporate is you learn how to be fast. Actually, it's more like you're forced to be fast. This could be either a good or a bad thing depending on what you make of it, because just because you're fast doesn't mean you're necessarily good. You want to get to the point where you're doing good dentistry, but in a very fast and efficient way. This is going to make your patients happy because they're going to get in and out, and it's going to make your staff happy because they can learn to trust you more, and it's going to make you more money, right? Who doesn't want that? But you have to really push yourself when you're in an environment like this, because it's very easy to get behind and make your patients wait, which happens a lot of times in corporate places. Or it's very easy to get sucked into bad habits and start doing crappy dentistry because you have patients lined up and you're already falling behind. That's one of the things that makes corporate so difficult, because most of them are just profit driven. As long as you meet your goals, as long as you meet a daily number, they're happy. They don't necessarily care as much about the patient's experience. And I know I'm generalizing, but this is the trend I've seen with most corporate places. So if you're a doctor at one of these places, it's really on you to make sure you're providing quality care. And sometimes this doesn't mesh well. Sometimes you could be a great dentist, but just not fit well in a corporate environment. And it's not that you're a bad dentist, it's just that you're not ethically aligned. And when you have offices that are so profit driven and they're taking insurances that pay a lot less, it makes sense why most doctor schedules in corporate offices are stacked. You know, I've seen double, triple booked columns in corporate offices where doctors are forced to make patients wait because there's only one body and they have 2 or 3 procedures to do at once. So I would use this to your advantage. Just do the best dentistry you can, but make sure you do it efficiently. This will pay off so much in the long run. And if you make patients wait, you know, it happens. It's not the end of the world. I would rather make a patient wait longer to start a class 2 rather than leaving an open contact and have to start all over. And we talked about this before, but another pro I have for corporate offices is it's easier to find a job, especially for those just coming out of dental school. Now let's talk about some of the cons of corporate offices. The first con I have is shady contracts. Now, you can obviously get shady contracts in private practices, but what I've seen from the places I've worked at is you're way more likely to get a shady contract from a corporate office. Now, what exactly is a shady contract? I call shady contracts that are like 20 plus pages in length that have very extreme wording that basically look like you're signing your life away. I've seen that in a lot of corporate places, and it's really scary to sign. This is why I recommend getting a lawyer to look over all the contracts you're thinking about signing. You can try reading the 15, 20, 25 pages yourself and think you understand everything, but you could easily miss something. This happened to me actually at one of the offers I signed, and after I signed it, I showed it to a lawyer just for them to take a look at it, and he pointed out a few things that I could have easily changed that probably would have benefited me, but that's how you learn, right? And don't sign anything you're not comfortable with. If you're not happy with the non-compete, if you're not happy with the day's notice that you have, the percentage of production or anything, just don't sign it. No one's forcing you to do anything. Another con to corporate places is you have to produce and see more patients than a private practice if you want to make the same amount of money. So let's say you're on production in both corporate and private practice. You're making the same percentage of production, you're seeing the same amount of patients, and you're doing the exact same procedures. Chances are you're going to make more money in the private practice because you're probably seeing people with better insurances, and you're probably seeing people with worse insurances in the corporate office. If you do an extraction in a corporate office where they're seeing Medicaid patients, you're probably going to make like $10, $20, where you could make a lot more if you're seeing the same thing in a fee-for-service or patients that have just better insurances in general. So another con with corporate offices is there's really no room to grow. And I know we talked about this already, but on top of not being able to do as many procedures, you're also limiting yourself in terms of how much money you can make. Because one of the reasons that we talked about before is you're seeing a lot of Medicaid patients and you're kind of capped as to how many patients you can see. On top of that, it's really hard to get into ownership. Versus if you're an associate in a private practice and you get into ownership, there's a lot more potential there. obviously you take on a lot more risk, but there is more potential. And another con that I wanted to mention again is a lot of the patients will end up waiting a lot. And sometimes it's kind of out of your control where you have a lot of emergencies coming in and your staff just books you out the rest of the day. And sometimes certain procedures take longer than expected and patients will end up getting upset and they'll be waiting a lot. This is just something you'll have to deal with. It's definitely possible to get it to the point where you have a very good schedule and there's not as much waiting for patients, but in the beginning, it's a lot harder. And one of the issues I had with corporate was my staff was very inexperienced, and when I worked there, the staff was not happy. There was a lot of issues with the manager. There was very inexperienced front desk workers, and everyone was doing the best that they could given the situation they were in. But the turnover was just so quick that when I worked there, everyone was brand new and no one really knew what was going on. So it was really hard going into a new environment when everyone was starting from scratch. So sometimes it's more than just doing the dentistry. It's also, talking with your staff, dealing with the manager, and making sure everyone is happy. And if your staff isn't happy, or if someone's just bringing their bad attitude into work, it just makes your whole life so much harder. And we touched on this before with corporate places, but they have a tendency to entice you to do more treatment than necessary. And the reason is most of your contracts are on production. So that alone is enticing for doctors to try to do as much treatment as possible. On top of that, you have insurances that pay less. So in order to meet the minimum or meet a certain goal that doctors have in these contracts, you have to do a certain amount of procedures. It's tough when these corporate offices are kind of breathing down your neck and telling you need to produce more. But you need to understand that you earned the title to be called a doctor. It's a privilege to be able to treat patients and have patients trust you. If you recommend a crown to a patient, they trust you that you're coming up with the best treatment for them. And it really sucks that there's some people that go through all this work and become a doctor, but probably still fall into the trap of these corporate offices and start doing unnecessary work. That's the last thing you want to do. You want to make sure you put the patient first no matter what. And for me, if that means making less money or making less production or making my manager mad or the corporate office telling me I need to produce more, that's just something they have to deal with. And if they release you, then at least you know that you were sticking up for yourself and doing the right thing based on your moral decisions. So I got a little lucky because the place I worked had more autonomy and I got to basically dictate the exact treatment I wanted. But what really should be done is the doctor decides what's the best treatment plan for the patient. And you can kind of structure that from like A to Z, from the best treatment, which is probably the most expensive, to the worst treatment. And ideally you would ignore the price. But that's obviously not possible because most patients are only going to get what they can afford. But that being said, I always present the best possible treatment to the patient first, no matter what the price is, even if the patient thinks they can't afford it. Because most of the time, these patients haven't been told what the best options are for them. So just being there to explain what the best treatments are and explaining why and what the reasons are, it can go a long way with these patients. Now, one of the things I've seen in corporate places that sucks is I've seen doctors treat patients differently depending on their insurance. Because over time, if you work there long enough, you know what insurances are going to pay and you know what insurances are really not going to give you anything. So I've seen kind of both ways. I'm not going to name any names, but I've seen people overtreat patients that don't necessarily need all this treatment. And it's really common in dentistry to have different treatment plans and for some people to be more aggressive versus some people to be more passive. Sometimes it's better to be more aggressive in certain cases, but I'm talking about just gross negligence and just doing completely unnecessary treatment. And that's kind of a theme in these corporate offices, which really sucks because some of these patients do have good insurances. They just don't realize that the work they're getting is not so great. And I've also seen doctors delay certain patients and try to get them rescheduled just because they know that their insurances aren't going to pay. And it's hard on the doctor because they need to make money. And most corporate places only pay the minimum salary for 6 months. And after that, it's entirely on production. And if they're seeing patients that don't pay anything, it's got to be tough because, they have to pay their bills too. And that's one of the things I just hated about corporate, because if I were to just fill my schedule with just doing quality dentistry and diagnosing only what was needed, I'm not going to make as much money as most people in the corporate offices. But I just did not like that culture, and that was probably the biggest turnoff for me to corporate offices. The way I approach corporate, and the way I think everyone should, is just ignore the money and just do the best dentistry you can and get as much experience as you can. Really, corporate is just there for you to get experience. Most people don't want to stay there long term. Now, there are exceptions to that. Some people love the corporate lifestyle, they do great dentistry, and they're very fast. So for some people, it's better to be in corporate. But most of the time, I've seen people opt for private practices after they get burned out in corporate. Now, with that being said, let's move on to private practice. With private practice, you generally have a more manageable schedule. If you worked at corporate beforehand, you are much less likely to fall behind, and that's good because your patients here generally have higher expectations. And going off of what we said before, with private practice, there is more room to grow, both in terms of how much money you make and the procedures you can do. Those kind of go hand in hand, because if you're doing implants, you're going to make a lot more money than doing class 2s all day. On top of that, you're probably seeing better insurances, and you have patients that can actually afford the higher end treatments that you're planning. So here you have more opportunities to take your CE courses and grow and actually advance on your skills. Another pro I've seen is the staff is generally happier and more skilled. At my corporate office, my assistants were brand new. Like I said, the turnover was so high that they really did not know much, and I had to train them from the very beginning. And in the private practices I've worked at, the staff is generally way more skilled, and the assistants are either already trained or the owners are actively training them. So that being said, you want to make sure the owner is taking care of their employees. That is what makes the staff happy and makes your job a whole lot easier. And that's especially true now because with all the COVID stuff, it's really hard to get good staff and get people that want to work. So going off of that, you want to make sure that you visit the practice that you're thinking about. You can't just sign a contract and look at pictures on Google and assume everything's going to be fine. You want to actually go to the practice and see how are the staff being treated, how is the owner talking to the staff, how do the staff talk with their patients, do the staff generally seem happy? I would even say it's a good idea to talk with some other associates there and see what they think. They're going to be the ones that are honest with you, and they're going to tell you some of the things that they don't like and some of the things that they like. So if they all seem happy, then that's a really good sign. And one of the issues I struggled with was I was the only doctor going into my corporate office. So if you're the only doctor in an office, you are the leader. Even if you're not an owner, people are going to look up to you because you are the doctor and you call all the shots in terms of the clinical care that you're giving. At my office, I had a really hard time with my manager micromanaging every single thing I was doing. I would recommend a certain treatment, or I would say a patient needs to come back for certain impressions for a denture, and she would just talk back with me and say, no, you can do this in less appointments, or you can just advance to the next step. And I was thinking, like, you're not even a dentist. How do you even know what you're talking about? So that was kind of an issue that I did not see coming in because I was just coming in to do the dentistry. I thought everything was fine. I thought everyone was doing their job correctly. And over time, I kind of realized that there was a lot of issues with the practice. Now, private practice also has its cons. The patients can be very picky. They will sense if you're a new doctor and they'll sense if you're nervous. And if you are, they'll eat you alive. My very first patient experience after dental school was a crown prep on this lady in a private practice. Now, this lady was very picky and she knew I was new because I didn't even know where the burrs were. I wasn't familiar with the office. I wasn't familiar with the assistant. And I was asking a lot of questions that seemed like I was brand new to the office. She asked me at one point if I was new, and I told her yes, but I know what I'm doing. But she didn't take that so well, and she never wanted to see me again. So I got thrown into the fire, but it takes time, but you really have to build your confidence when talking to these patients. Because you know what you're talking about, you just have to show that you know it. And another not so con, but something you want to look out for is you want to make sure that the owner is doing a good job and you know what their goals are. You want to see if they're willing to mentor you, how much longer they want to keep working. I had one instance where I started working in a private practice, but the owner doc wanted to retire like right after I got there. And that was tough on me because all the patients wanted to see that owner doc and they didn't want to see me, who was this new guy. The issue was I didn't even get introduced to these patients. So all these patients just see this new face and they're wondering what happened to the guy they've seen growing up. So that was kind of tough for me because it was really slow. And that brings us to our next con with private practices is it could be really slow at first. Especially if the owner doc has been there for a long time, most of the patients want to stick with the owner. So it's going to take a lot of time to build up trust and rapport with these patients. That's another reason why if you're a new grad, it might be better to do corporate first because you'll be making more money to be paying off those loans and you'll get more experience doing that bread and butter dentistry that will help you if you wanted to do private practice in the future. Now, working as an associate is different from being an owner. If you're an associate, you're still an employee. So the issue with that is you won't have as much say in issues dealing with staff. So for example, that same private practice I was talking about, I had an issue where the assistant was showing up late and I would have to set up the room myself and the assistant wasn't necessarily doing her job half the time. And if you have an owner that isn't really standing up for you, you don't really have a say and they don't really have to listen to you. And this is why I say it's so important to visit the practice and just get a feel of the place. Can you actually see yourself working there? Do you get along with the staff? Are you getting along with the owner? You want to get familiar with everything. I would get familiar with the drive, parking there, the operatories, how big the actual operatories are. Are they just for lefties or do they have space for righties and lefties? How many x-ray sensors do they have? My corporate place only had one x-ray sensor for the whole building. And if I was doing a root canal, but hygiene had to take a full FMX, that was really difficult because we had to transport and disinfect the x-ray sensor from one room to the next. You also want to check how trained the assistants are. Are they short-staffed? Does their staff still require more training that you're going to be responsible for, or is that the owner's responsibility? This is all things to think about. All these things aren't deal breakers, but they're going to help you make your decision. So with that, thank you for watching the video. If you wanted to make any more points on corporate versus private practice, let us know in the comments section below. And if you haven't already, make sure you hit that thumbs up button and subscribe to our channel so you get notified for our newest videos. And we'll see you in the next video.